This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Chris von Hacht, who's an associate professor and a very distinguished health services researcher, but also the head of quality and safety research at the Leuven Institute for Health Policy in Belgium. I met him last year, and I learned about a movement that he is leading that's really the subject of our discussion today, the Mangomoment movement. Now, Chris, could you quickly retell the story of how the Mangomoment came to be?
Of course, Tom, and thank you for the invitation. The original Mangomoment already dates back to 2015. We have a well-known Flemish journalist reporting in a series on life as it is, and in that series, she also stayed in an intensive care unit, and there she spoke to doctors, to nurses, to family members, and also to patients. And one of those patients she visited was Vivian, who had suffered from sepsis, and she had been in coma, being resuscitated, quite a story. And a few weeks after Vivian woke up from coma, she met a journalist, and she had an in-depth conversation with her, in which she even talked about her demand for euthanasia. But she also explained how she slowly started to enjoy the little things in life again. For example, as she was looking forward to finally being able to eat again. And then the journalist asked the question, and what would you like to taste again? And to which Vivian said, a mango. And a little while later, the journalist went back to visit Vivian and offered her a mango. Vivian burst into tears, and as a viewer, you could just see how she really and truly enjoyed this. It was a blissful piece of television. And I vividly remember watching that and being deeply moved myself, and I decided to start a project on person-centered care, which we called In Search of Mangomoments. And that is how it all started. I wanted to have a more profound understanding of this kind of interaction. And also I wanted to understand what the preconditions and effects were. And you know, Tom, in the original report on television, Vivian said, I will never, ever forget this. And this is really true. She's enjoying life again, and is now also highly involved in the Mangomoment movement.
Well, healthcare is one of those fields where there are lovely moments like this all the time, mixed in with many terrible moments. And the lovely moments very often are like a pebble falling in a pond. That's an American expression, which probably you have a version of it in Belgium. Mm-hmm. And one of the things I liked about you when I met you right away and respect about you was that you recognized that this might be something significant, and you're doing things to make it more than a pebble falling in a pond and then being forgotten. So what is the definition of a Mangomoment, the term that you have made something that's going to endure forever, I think?
Well, let's hope so. There is an official definition, which is also now included in our official Dutch dictionary, and that is a moment of great value brought about by small unexpected gestures that require little or no time, money, or effort. That is a Mangomoment. But as you say, maybe it sounds complex, but everyone in healthcare can integrate these Mangomoments in daily practice. So if people ask me what a Mangomoment is, I always say small acts of kindness and leadership. Small acts of kindness and leadership. That's also the subtitle of the book we wrote about Mangomoments. So small acts of kindness and leadership.
Now, you are a researcher, and you took a researcher's framework to Mangomoments. You weren't just giving a pep talk. How did you go about collecting data and analyzing them?
Well, that was quite a journey. For our research, we were supported by Stand Up to Cancer, a charity fund in Belgium, and they supported us for several years. And the first study that we performed was explorative, in which we looked for Mangomoment stories. And through social media, we asked patients, loved ones, healthcare professionals, and managers to briefly describe their Mangomoment stories and send these stories to us. And whereas our original goal was to collect about 100 stories, and distribute them to inspire others. We were surprised to have received over 1,000 stories in a few months. And with those stories, people could also indicate it if they were willing to participate in a qualitative study with in-depth interviews. And based on this recruitment, we were able to conduct 120 in-depth interviews. And for those listeners who know something about qualitative interviews, they know that 120 is a lot. It was more than we needed for saturation, but they were so inspiring. So the team did additional work. And from these 1,000 stories on the one hand and the 120 interviews, we could conclude that there were clearly some preconditions. And these were from patients and carers and organizations, as well as three main different consequences, namely impact on the patient and the loved one, impact on the carer, and thirdly, very interesting, I think, the impact on their mutual relationship, which we called positive resonance. So when we first published about Mangomoments, it was back in 2018 in the Lancet, and later on we created a Mangomoment model and we published it in BMJ Open. Only then it was taken seriously. Before or not, they were joking with us. Oh, Mangomoments, oh, very good. But when we published about it, then it was taken seriously. And now we have also the documentary in which we explain the model and the concept, but we also explain how we introduced that into 30 healthcare organizations who started working with the concept and the model. So if you want to learn more about the experiences and the learning points from these 30 pilot organizations, I warmly invite you to watch the documentary that is available right now.
Well, I have talked about this work with many people working in healthcare, and one of the common observations is that we clinicians, we doctors, we tend to spend a lot of time thinking about, well, what am I getting paid? What am I getting from my work? Whereas what really sustains us in the long run is how many mangoes did we give out, and being aware of when we gave out a mango is actually something that my colleagues and I have felt this is one of the most fundamental types of rewards. So understanding Mangomoments so we can recognize them and give them out more often and regularly is one of the things that's so attractive about this. Now, you have broken down the themes that characterize Mangomoments, which should help us recognize them as we go about our work. We don't have time to discuss all the themes, but can you focus on the one that was most prevalent in the data that I have read, respect?
Mm-hmm. Well, it's all about these small acts of kindness and leadership, and you're correct, Tom. It's a very important thing, although we don't talk about it a lot. But if I would discuss respect, I would like to discuss it from the three different perspectives within our Mangomoment model. You see, respect can be considered as a precondition for a Mangomoment, but it can also be seen as a Mangomoment itself. And finally, respect is also a consequence, or can also be a consequence. So if you look at respect from a precondition, I see it as part of the organizational culture. And although that a Mangomoment is delivered by an individual healthcare provider to a unique patient, we see time and time again that there are organizations where this is more prevalent than in others. This has to do with the respectful culture in the organization, I think. And in the Mangomoment book, which is also available in English, a colleague of mine, Professor Herman Daams, discusses in his reflection on Mangomoments, he discusses mangoes grow where the climate is right. And this is not only true for mangoes, but also for Mangomoments. So respect is a precondition, but respect can also be an example of a Mangomoment showing respect. I always choose the ordinary, everyday things, not the grandiose examples of Mangomoments, but the small acts of kindness and leadership that we can do day by day, like showing real respect to each other, the kind word, the small gesture, the real listening. That is what always touches me most and is really inspiring. So it's respect is a precondition, can be a Mangomoment itself showing respect, but we also see respect as a consequence of Mangomoments. I remain most inspired by the positive resonance that it creates and which makes patients dare to really be honest about their symptoms, their thoughts, and their feelings. That is because of the respectful relationship. By the way, it appears from several interviews that patients also dare to ask more honest questions as a result if they have the positive resonance with a medical doctor or a nurse or another caregiver. Also, if they have doubts about patient safety, they dare to ask the question, the real question to healthcare professionals. And so this brings for me the full circle with my research on Mangomoments, but also my research on patient safety incidents, as you know, Tom. So for me, they're all pieces of the complex quality puzzle, and also their respect is both a precondition and a consequence. It's not a grandiose thing. It's a very normal thing that we can do day by day without that it takes a lot of time, effort, or resources. It's about good healthcare.
Well, that dissection of respect is a good example of why I really encourage our audience to go online and read more about Mangomoments, because it's much more than an exhortation to be nice or be good. You have really dissected some of the ways in which people are being at their best so that we can understand the nuances and make them happen more reliably, and picking apart, you know, the nature of respect as an example. This will make us better. And frankly, it's the kind of discussion that makes life worth the living. It makes us better in our personal lives as well as our professional lives. Now, our fond hope, our shared fond hope, is that the Mango Moment observation that you made is going to be more than a big rock falling in a pond. It's really generating a movement. I think it has. I hope it has. But tell me, what are your fondest hopes for what this will lead to so that maybe we can do our part to help?
Mm. Well, it's about the human interaction, and I hope it stays about the human interaction. You cannot organize these Mangomoments. It has to stay normal, but also the human part is, and the interaction part is very important. It all started with watching the television program back in 2015. And afterwards, we conducted the research and implemented it in more than 30 healthcare organizations. And we additionally inspired during the previous years other colleagues throughout Europe, as well as in Kuwait, in South America, in the US. And now we have released a documentary, Mangomoment, A Small Act of Kindness and Leadership. It is available for free, also in English, via our website, mangomoment.org. It's a 45-minute video that can be used as an inspiration, but it can also be integrated as part of a workshop that or a learning moment that you organize with your colleagues, with your students, with patient organizations, or even just with your friends and family. In this way, we hope that our Mangomoment adventure can continue to inspire healthcare professionals with a good heart. So I would say, Tom, thank you for spreading the news. The Mangomoment documentary is available. And who knows, maybe it will help a lot of clinicians to build better relations with their patients within their team. And as we conclude in the book and in the documentary, always be a little kinder than necessary, because Mangomoments can make healthcare a little sweeter. Always be a little kinder than necessary, because Mangomoments can make healthcare a little sweeter. So that is what we hope for our movement. And if that would be used, and the documentary and the research would be used also with your listeners and with our other friends, that would be more than a Mangomoment for our team. So thank you, Tom, for giving us the platform today.
We will provide the links to the various resources that you describe. And I can tell the audience that that 45-minute video is very much worth the time. I I do have high hopes that the impact will make care better for many patients, but I have even higher hopes that it will make care better for people taking care of patients. Because I do believe, as I know you do, that the beneficiaries here are the people giving out the mangoes, not just the ones receiving them. And that we can help make a dent in the problem of burnout that is an issue everywhere in the world for people taking care of patients. Is not the only thing that we can or should do to address burnout, but this is one of the things. And you've done a real wonderful service by identifying mango moments and then bringing a researcher's perspective to it. I thank you so much, and we will try to do what we can at NEJM Catalyst to help with the value of healthcare by spreading this among many, many other insights and innovations. Thanks so much, Chris.
Thank you for your kindness and your leadership, Tom. Thank you.